I did my clinical psychology training at the University of Canterbury, and back then you got assigned essentially to a placement, and I got sent to the Department of Corrections. 14 years later, I'm still here. And in a treatment environment where you see people begin to make change, as a psychologist, that's one of the most rewarding things. That's why we do this job, that working in a treatment program that you know is effective, that you can see the results, that's some of the most rewarding work you can do as a psychologist. I think part of what draws a lot of people to psychology is the idea of making a difference and making a change and assisting people to understand how they've made the choices. The sexual abuse of children is abhorrent. And as a society, having programs like this that support people to understand what they've done and learn the skills never to do this again, that's a good day's work. Working within a psychological team to ensure that really is the end goal here, a safer community. I can honestly say in the last 14 years I've never been bored once. There's a huge variety in this role, from early in my career when I was delivering group treatment, yourself as a psychologist in the room, 10 men doing group treatment for 9 months. So learning the skills of how to deliver group therapy, moving through to progressing to the supervision of the program, the supervision of other staff. A big part of my role is training. So I work with training psychologists, probation officers and risk assessment measures to assess the risk, recidivism risk for men who've sexually offended against others, be it children or adults, and also working with our custodial colleagues to create the community of change environment. It's pretty unique work to try and replicate in a prison environment the principles that we want in our communities: openness, honesty, respect, responsibility taking, to try and work to create a prison environment that supports those values. It's a pretty rewarding task, but it's one that constantly requires work, because just like any community, there's ebbs and flows. So having the opportunity to really work cross-service, and both within the department and then also form those connections within the wider community, I think is part of what keeps you in this job, really. When I look at the range of tasks that I get an opportunity to do, whether it be from higher level reports, extended supervision order reports, parole board reports, right through to treatment, group treatment, staff supervision and training. I mean, there's a huge amount of variety in the role. And if I talk to my peers who are working in other contexts, whether that be within health or within private practice, that range of experience isn't really replicated to the same degree. The opportunities aren't really, the variety of the role isn't really there to the same degree. I guess that idea of team is really important. That's what keeps you in this job. I work with a great team of people.
Where do you ultimately want to end up job-wise?
That collegiality and that cohesiveness is a big part of what keeps you walking through those prison gates every day. I'm proud of the work that we do. The recidivism and the statistics speak for themselves, that actually what we're doing keeps communities safer, and that's really what we're trying to achieve at the end of the day.